Well, hello there. This is Mark Ittleman, speech-language pathologist from the Teaching of Talking and the Teaching of Talking training. This particular video is going to be about the opportunity to learn how to do speech and language stimulation, the ability to help people talk who have aphasia, and the ability to learn how to help people who have apraxia speak. Now, one of the things about our healthcare delivery system is that the amount of therapy that these speaking difficulties require is considerable. And quite often, people are really mistaken when they believe that speech therapy once or twice or three times a week for a half an hour or 50 minutes is really going to make a big difference. Quite often it doesn't. But I'll tell you what does make a difference. And that is that if you have a speech pathologist who will work with your loved one who's got apraxia and aphasia and also require that you are involved in the process, so that each and every visit, not only is the person with apraxia or aphasia being helped, but the caregiver or the wife or the spouse is also learning what to do at the same time. Now, that's amazing, because what happens when a caregiver learns how to help a person speak who has apraxia or aphasia, what happens is that they can stimulate a lot of speaking at home. And what do we know about speaking? Well, we know that the more we speak, the better our speech is. If a person has a stroke, the more we practice the facilitation of language and speech, the more language and speech emerge in almost every case. So the whole idea of speech therapy is to find the best method and the best technique to address an apraxia or an aphasia, teach that to the caregiver or the spouse, and then have that person utilize what he or she has learned all through the day at home. And then what happens is that the more speech is stimulated, the more the person with aphasia or apraxia has an opportunity to practice speaking. And I'm not talking about saying word lists or looking at flashcards on the table. That's not what I consider to be interactive speech therapy. What I consider interactive speech therapy is that throughout the day, when the person with apraxia or aphasia needs to communicate something, that at that moment, the caregiver helps that person say that word or say that phrase, and that is done continually every day, 7 days a week, morning, afternoon, and evening. And it's an amazing process to teach a caregiver many of the methods that a speech pathologist knows, and then to watch them implement that at home around the clock. And when they come back for therapy a week later or a couple days later, one can see a measurable improvement in speech outcomes. So that's what I wanted to share with you today. The idea that if you're a caregiver, you can really influence the speed and the progress of your loved one. Now, most caregivers think, well, it's up to the therapist to do this, okay? And they're not progressing as fast as I think they should, so, I'm not sure if I like the therapy that my loved one is getting. But the whole idea here is, again, that speech therapy is never going to be enough 2 or 3 times a week at a clinic or online or whatever it is, unless you're being trained to use those techniques at home to help your loved one speak better. This is Mark Ittleman, speech-language pathologist. Down below are a bunch of links. So if you want to get in touch with me, do that. If you've liked this little video, please give me a thumbs up. And if you'd like to be mentored, or if you'd like to learn how to help your loved one talk, kindly reach out to us. There's plenty of links below to help you do that. So we hope that you have a great day today, a great week, a great month, a great year, and of course, a great lifetime. Bye-bye now.